Hi, it's Catherine McQuaid from Trust Robin. We are a patient and clinician education group. We work in both video and app-based materials, so therefore everything is mobile enabled. And we will walk through 3 different use cases today, and we will do this on our digital partners platform. We are at the welcome screen of IMD Health. And because they have set up a wonderful platform for sharing materials that are medically and clinically compliant and have been reviewed and are easily therefore shared with patients, with their patient families, and with other members of the care team, let's walk through together 3 different use cases. I'll concentrate on the third, but for the moment that there are 3 different groups generally who use our materials in slightly different ways. One is the physician-clinician, and this could include other members of a patient care team. The second group that use our materials is the consulting and retail pharmacist. The consulting pharmacist is often off-site or in a home care setting, often doing medication therapy management. This is the group that we'll concentrate on when we walk through the case together. And the third group is the community pharmacist. This could be someone in a retail store setting, or it could be a pharmacy in a clinic or a hospital. Since we are at the home page, let's just stop for a second and look at how the information is organized and how you navigate. You'll notice right away that in the welcome screen there is the assumption that you can be completely self-serve if you're a first-time user and you're up to speed immediately with how to use it and how to therefore share the materials when you're in front of a patient or you're being consulted in a retail pharmacy or a home care setting. So you'll notice in the navigation panel, in the content panel, that one is educate a patient, and the little icon, the body, indicates that there are locations on the body that would relate to the spots where a sufferer or a patient is indicating that they have concerns. And so although you might choose the same materials to educate a patient with, if it's in the context for them around the presenting symptoms in their body, it might make more sense for them. The other 2 panels are suggestive of where these materials come from. A lot of our materials come from health associations and or advocacy groups, and therefore you can be confident that these materials have been reviewed both for clinical and medical compliance. You can assume that the materials are developed with the patient in mind, so it's everyday and yet medically compliant language. And so we'll just start and we'll walk through a patient situation. We're assuming that we are a consulting pharmacist, that we're doing a medication therapy review, and we are offering a concierge service in a senior care setting. Notice before we leave this screen that the materials, when they come from you, will be branded. This is us, this is Trust Robin, so at the end, when I go through a patient case demo with you and we send those materials, they will come out from Trust Robin email identification. So if you are part of a clinic or a hospital network or a retail pharmacy, the branding will help identify and secure that recognition and the patient confidence that it has come from a trusted source. So we will just go right into as a hypothetical patient. I'm going to supply an email so that we can see how it actually gets sent off at the end of this consultation that we're doing. I'm putting in my own email for demo purposes, but if you have the patient email and the other caregiver's family and or other people, other clinicians involved in the care team, then they would go there as well. We come immediately to my shortcuts, and I've set them up because these are the disease states that I see quite frequently, that they are the ones that people have the most questions about, so that makes it easier for me, especially if I'm working on my tablet or my phone and I'm at a point where I don't have a lot of extra time. This really is saves me a lot of work. And other resources that I either use a lot or that I like. We have stuff, as you can see, that's related to particular conditions or particular agencies, health agencies. And these are our skin and wound care videos. They are related to both clinical wound care specialty types of circumstances as well as over-the-counter. And the treatment options are also here. We have a complete selection of pharmaceuticals. I'm not going to go through them today, but you can see that I have set up my shortcuts because these are the kinds of things that I use quite often. We have two ways to get to the material for a patient. If we are being asked to talk about specific symptoms relative to spots on the body, we can do it that way. I'm going to walk through a type 2 diabetes hypothetical patient today for demonstration purposes. And we'll assume that this patient also has concerns relative to foot ulcers. Therefore, I can go to conditions and I can find diabetic foot resources. And we're here now, so I'll just point out that we have a lot of great information that I have already opened, and therefore it has shown up as an attachment in this email icon. This tells us that this document will show up in the list when we're finished, and it will all be, once I send it, it will all be attached to the email that I'll send. So now I'm in the middle of a consultation with a patient. I have a way to look for other things that could be useful. I'm going to include for this patient the diabetic foot care guidance that comes from the Canadian Diabetes Society. You'll notice that the materials that I'm showing you today are all Canadian. If you are in Quebec, everything is in French, and if you're in the United States, we have access to the Mayo Clinic's library as well as other partners. So the same kind of compliance and review exists for all the materials that you would find, and you would set up your library relative to your own state or your own governing bodies. So we're back now at the top in the navigation bar. You see we have diabetic foot, and I've got two attachments in there now. I'm going to go back one more screen so that you can also see that the topics are organized in a second way, which is systemic. So although diabetes is here, I'm going to just give you a quick preview for reference later that there are a number of other conditions, and you can choose whichever way you're going to end up. The systemic topics will then give you in this case, when I'm consulting with this patient, this type 2 diabetes patient, I'm going to give this person a bit of guidance relative to complications, because skin conditions is one secondary symptom, but there are other things that they might want to discuss with me. They might be suffering from sleep apnea. They might start to, when they have other tests related to blood pressure, things like that might start to show up. I am going to look at some of the Healthy Grains Institute materials. I especially like the 10 Reasons to Choose Whole Grains, because this is an older patient, and I know that they do not use a lot of this type of nutritional thinking, just because they haven't had the advantage of doing that, and I know their family would be interested in that. So I have now 4 documents in the file ready to go, and I will show you how that then is summarized for you before you send it. These are the 4 documents that I've chosen to send. If I don't want one of them, I can just delete that, and I can personalize the email, because this is going to come in as an email to them. I'm going to make it friendly. I'm probably, if I've got a scheduling tool, I'm probably going to indicate when I see them again. I'm going to include other caregivers, family members. If I have their emails, I don't have to do this all right in front of them. I have time to put together the rest of the email list if they are, for instance, the podiatrist who's working on the foot care ulcer part of it. I'm going to click the compliance so that is all done, and then I send that. And I have now completed a patient education and documentation step, which is very useful because I'm practicing in the United States. Therefore, our clinic is participating in QPP, which is Quality Payment Performance Initiatives, and this documentation will track the patient usage. It will also be able to correlate disease state improvement, other sorts of conditions, because this is now a file that is shareable. I can integrate that with my meds review schedule and the other primary care physician scheduling and even the script refill schedule that was part of the medication therapy management consultation, which was the reason for that visit. I will, before we end, I will point out that when you go to the IMD site, and the address is in the link underneath this video, you'll be able to sign up for an account. And if you are part of an institution which relates to branding and being able to repurpose these documents, whether it's community-based education or wellness programs that you might be running with health insurance partners, for example, or related healthcare providers, there is another way to use the materials, which I'm not going to go into today, but all of that is available. And I encourage you to visit the Trust Robin site. We haven't spoken a lot about what our work is, but you'll find us at the bottom under associations, and if you were interested in the probiotics video, I'll just play a little section of it.